Here we'll learn an overview of non-Enterobacteriaceae gram-negative rods that can cause respiratory illnesses. Let's begin with Haemophilus influenzae. Indicate that it's transmitted via respiratory droplets. Show that there are two types of Haemophilus influenzae, non-encapsulated and encapsulated. Then write that Haemophilus influenzae, non-encapsulated, also referred to as non-typable, colonizes the upper respiratory tract of many people. Show that the bacteria can migrate to other parts of the respiratory tract and cause sinusitis and otitis, and bronchitis and pneumonia. Show that patients can develop bronchial inflammation and or pneumonia with consolidation. Write that patients with chronic obstructive pulmonary disease, COPD, are at especially high risk of pneumonia from Haemophilus influenzae migration. Then indicate that encapsulated Haemophilus influenzae, especially type B, causes serious life-threatening infections in unvaccinated children. It's an important cause of meningitis and septic arthritis in young children, and is responsible for life-threatening epiglottitis, which is characterized by a swollen epiglottis that can obstruct the airways and esophagus. Show that patients have a sore throat and may drool due to the inability to swallow saliva. Next, indicate that Bordetella pertussis and Bordetella peripertussis are also transmitted via respiratory droplets. These bacteria cause pertussis, also referred to as whooping cough. Then indicate that infection is highly contagious and is most severe in infants who experience respiratory failure, and that clinicians are seeing an increased number of cases in adolescents and adults. Write that the DTaP vaccine protects children from infection. Let's show the stages of pertussis. Indicate that the incubation period lasts approximately 1 week. This is followed by the catarrhal stage, which lasts 1 to 2 weeks. Show that this stage is characterized by nonspecific symptoms of fever, runny nose, sneezing, and cough. Then show that the paroxysmal stage, which can last for several weeks, is characterized by episodes of forceful expirations, followed by a loud inspiration, the whoop of whooping cough. Because the fits are prolonged, oxygen levels can drop, leading to cyanosis, and indicate that post-pertussive vomiting can occur. Finally, indicate that the convalescent stage is characterized by reduced coughing. Complications are possible, including pneumonia and encephalopathy. Next, show that Legionella pneumophila is transmitted via aerosolized water, for example, in the mist from air humidifiers, shower heads, and others. Indicate that it causes Legionnaire's disease, which is characterized by severe pneumonia and fever. Write that older and less healthy individuals are more susceptible to disease. This bacteria also causes Pontiac fever, which is characterized by fever, myalgias, and other flu-like symptoms. Lastly, indicate that Francisella tularensis is transmitted via infected rabbits or bites from ticks and deer flies. Thus, tularemia is a zoonotic disease. Ulceroglandular tularemia produces skin lesions, often with black areas. The lymph nodes also become infected and produce tender, painful bulges in the skin. It's sometimes said to resemble the bubonic plague. Then show that this bacteria can cause pneumonia, which is why we've included it in this tutorial. Indicate that tularemia can also affect other organs, including the eye, mouth, and throat. This concludes our diagram.